Self-reported symptoms can be used to predict whether a person will develop COVID-19, according to a study led by researchers at King's College London. The symptoms of coronavirus infection can change over the course of a disease. Fever is common during later phases of COVID, for instance. Previous studies have tried to predict disease using symptoms from the peak of infection, which isn't useful for early detection. The new research, published in journal The Lancet Digital Health, collected data from the ZOE COVID Symptom Study smartphone app. Each user logged all the symptoms they experienced over the first 3 days, results of a subsequent COVID test, detected by PCR, and personal information such as sex, age and BMI. Researchers assessed 3 models to predict COVID from self-reported symptoms, which involved using one dataset to train a given model and testing performance on another. The training set included almost 183,000 people who reported early symptoms from the 16th of October to the 30th of November 2020, while the test dataset consisted of over 15,000 participants. The 3 models were: 1. A statistics method called logical regression; 2. The UK National Health Service (NHS) algorithm; and 3. An artificial intelligence (AI) approach known as a hierarchical Gaussian process. Of the 3 prediction models, the AI approach performed the best, so it was used to identify patterns in the data. Specifically, the AI prediction model was used to find which symptoms are most relevant in different groups of people. The subgroups were occupation, healthcare professionals versus non-healthcare, age group, 16 to 39, 40 to 59, 60 to 79, 80 plus years, sex, male or female, body mass index, underweight, normal, overweight, obese, and health conditions. According to the AI model's results, loss of smell was the most relevant early symptom among both healthcare and non-healthcare workers, and both groups also reported chest pain and a persistent cough. Symptoms did vary among age groups. Loss of smell had less relevance to people over 60 years old, for instance, and seemed irrelevant to those over 80, a result highlighting that age is an important factor in early COVID detection. There was no big difference between the sexes in terms of reported symptoms, although shortness of breath, fatigue and chills, shivers seemed more relevant signs for men than for women. No particular patterns were found in BMI subgroups either and, in terms of health conditions, heart disease was most relevant for predicting early COVID symptoms. The ZOE COVID Symptom Project is a non-profit collaboration between scientists and personalised health firm ZOE, which was co-founded by genetic epidemiologist Tim Spector from King's College London. The project's website keeps an up-to-date ranking of the top 5 COVID symptoms reported by people who are fully vaccinated, with a Pfizer or AstraZeneca vaccine, have received 1 of 2 doses, or are still unvaccinated.